Yeah, so something I do is I typically try to think of myself like a patient. And, thinking just experiences through life, going through different parts of the medical system and what I expected or what things worked. And I try to make that experience what I, as a patient, would like when I'm meeting with my physician.
I'm interested when the patient's there and what's important to them. Often that may be family members or things that I know they love to do. And I often will try to bring that into our discussion, especially to have a better understanding of their priorities and how that might be affected by different treatment decisions that we might think about.
You don't want to minimize people's symptoms. You don't want them to feel that what they're complaining of or what they're telling to you is trivial, not important, nothing to be concerned about, because they don't know that. I mean, they don't know that, and so that's why they're seeing you. That's why they're seeing the physician.
But I think the biggest piece of this is timely communication with patients and not ignoring their messages that they send electronically or via phone. So I always call people back. I always reach out back. If somebody's particularly ill or having a hard time, I will proactively reach out to them just to check on them because I'm wondering what's going on.
Patients want to know that you're engaged, that you're interested in them. And I think that's the first thing. So from the moment you step in the door, they want to see that your attention is directed right to them. And it's difficult. I mean, today's environment where we have EMRs, computers, where everything is done on computers, we're not using script pads, becomes very challenging. And so for the first few minutes when I step into a patient's room, I don't even go near the computer. I direct my conversation directly to them. Often asking them other things about not just their health, about family, really making sure they know that I'm interested in them as a person.
I think I try to make my patient interactions very personal. And I think it's getting to know people and knowing about them as individuals, not so much about their chief complaint or their chronic medical problems. I, during the visit, try to be present.
So you walk into the room, introduce yourself to the patient and to any of their family members that they have there. I don't sit at the computer and type my note while I'm seeing a patient. I sit in front of them and make eye contact. When I do have a patient with breast cancer, that can be a scary diagnosis. So I do my history and physical, and then I bring them into my office where they can sit down with their family members and we can have a discussion about their diagnosis and then their treatment plan. And then my last little trick is if patients have a big life event, like if they're going on a trip or someone in their family is getting married, I write that in my note, and then the next time they come to see me, I ask them about it. And they really appreciate that, that I remembered that, they were going to Ireland or something.
I think patient feedback is really helpful. I think it informs both the individual physician as well as practice operations, and it gives you things to work on.
And occasionally I'll see something and I'll be like, oh, yeah, that does sound right. The most recent one I saw was about long waiting time in the office, and it was a reminder to me, as much as anything else, that I often am running behind in the office. I think it's because I'm trying to spend time with the patients. But there's a flip side to that.
Sometimes you're not sure if it's working. Do the patients like my style? Am I communicating? Do they understand what I'm telling them? And you don't get that kind of feedback once you're an attending. And I feel like this is one of the ways that you can get that feedback and know, yes, you're doing the right things. You can continue with that. Or if something isn't working, that you can make changes and make your communication style better.
Feedback that we receive in the office doesn't just have to do with me personally. It has to do with patient's whole experience in the office, actually. So they're very valuable comments. They're about how the flow of patients is through the office and what kind of communication they appreciate from the staff.
I think patient feedback is great. It's always satisfying to hear that a patient is satisfied with your care. I think that's so important. It's why we do what we do.